Hi everyone, Dr. Luke Pedersen here, physical therapist with the Knee Replacement Therapist. For this video, what I want to talk about is CPM machines, also known as continuous passive motion machines. What is it? What are the pros and cons? And should you use one as part of your recovery and rehab after surgery? So a CPM machine stands for, again, continuous passive motion. And basically what this is a mechanical device that is used for providing motion for your knee, range of motion passively. So what you're doing is typically you're laying on your back, either in a bed or something else, and the device is on the bed and your knee is up in this device and strapped into it. And what it does is provides continuous motion at this predetermined range and a predetermined frequency or speed, and all you're doing is just relaxing there and laying there. So typically the speed is about 2 cycles per minute. So what that means is it goes through one cycle is straightening as far as it's set for, and then bending and flexion as far as it's set for. And it'll do that 2 times every minute. Typically you're on the machine, you're in the machine for an extended period of time. So you're thinking 30 minutes, 45 minutes, up to an hour or more. And you're doing this maybe 2 or 3 times per day, typically the first couple of days in that kind of acute phase after knee replacement surgery. And the range of motion is also predetermined and set. So it's set at obviously a smaller range of motion initially, and then hopefully increased incrementally, progressively, as your range of motion improves over the next couple of days. So the thought is now, so what is this a beneficial piece of equipment? Is this a beneficial thing to include in your rehab after surgery? You think it would be good, works on your range of motion, improves the straightening and bending of the knee. Let's see what the research says a little bit. So there's a handful of different studies out there, and each one is really comparing 2, maybe 3 different groups. And what the groups are typically are there's the one group is individuals who are getting physical therapy and or exercise. And then they're just getting physical therapy and or exercise and not getting any, or not using the CPM machine at all. And then they compare this to the group of individuals who are getting physical therapy / exercise and are using the CPM machine 2 or 3 times per day. And they compare these 2 groups, people who are basically, both groups are getting exercise, physical therapy, one group's using the CPM machine, one group's not using the CPM machine. And they compare these groups and they measure the range of motion in the individual's knees at different time points, everywhere from 2 days after surgery, 5 days, 7 days, 3 months, 6 months, and even up to 1 year after surgery. And all the studies show, at least the ones that I've looked up and seen, show that there's no statistical difference in the range of motion of the individual's knee at any of these time points. So basically what this is showing is the only thing that was different between the 2 groups, theoretically, is one group used the CPM machine and one didn't. And the group that used the CPM machine showed no improvement in their range of motion. So kind of shows that this might not be as beneficial as we think. Another thing to think about is when you're on the CPM machine, like I was saying, you're strapped into it for an extended period of time, usually 2 or 3 times a day. And that's a long time to be just laying there on your back, essentially doing nothing else besides just letting the machine move your leg slowly. So that time, a lot of people will think, and I personally agree, can be better used in a lot of different ways. For example, doing some more walking. For example, getting some other active exercises, active range of motion exercises, or even active strengthening exercises. Or it can be used just resting your body and sleeping. Some people are able to sleep with the machine on, others not so much. So there's a lot of different things that you can do instead of spending that prolonged period of time in a CPM machine, which has been shown by the research to not necessarily provide that significant of a benefit. So I will say that it's not, never should you use a CPM machine. There are some individuals who, it's appropriate for, who might have just a lot of limitations in their mobility. They might have a lot of swelling and discomfort and pain, and it really limits their ability to do active exercises and get up and get moving without significant discomfort, significant pain. So possibly the CPM machine could be a good way to start to initiate that range of motion that is a little more tolerable for the patient. But I think for the majority of individuals who are up and moving after surgery, can tolerate the active exercises, they might not be comfortable. There's still some pain and discomfort, but they can tolerate them and do them. I think they're going to get more bang for their buck doing the active exercises, the physical therapy, just getting up and moving and walking, rather than spending prolonged periods of time on a CPM machine. So that's my thoughts on CPM machine. I'd be happy to wonder or hear what you have to say if you have any thoughts to the contrary, any personal experiences. And let's all learn about this and grow. And we always, of course, our goal is to do what's best for the patient and what's going to help you have the best, most efficient and most effective recovery from your surgery. Thank you very much for watching. Take care.